Hello, welcome to today's Insta Live, and today we're going to talk with Shaun from Gannett City Fertility. We're going to talk about restarting treatment. So let's see if we can invite Shaun to join us on our Insta Live. We're going to talk about restarting treatment, which can be so challenging because when you are thinking that a lot of you have been having certain anxieties, fears, frustration for having their treatment stopped. But now that you need to restart, there's all sorts of things that you need to consider because we are still in the midst of a pandemic. So how does treatment look like if you are having treatment now during the coronavirus pandemic? That's what we want to find out with Shaun. Let me see if I can bring him on to this Insta Live. So we are really looking forward to speaking to Shaun. Shaun is the embryologist at Gannett City Fertility, and we're going to bring him into this conversation today. We talk about all the things that you need to know if you are starting treatment during the coronavirus pandemic, because things might look a bit different to before. Hello, Shaun.
Hello.
How are you? Hello.
Very good, thank you.
Welcome.
Hello, everyone.
So you are joining us straight from Gannett City Fertility's lab. You are joining us.
I certainly am. I thought in this time of COVID, I would give some evidence that we have restarted and we're able to offer care to couples. So we've had a little bit of a longer day than usual, so I thought I would say hello from here.
That's a great idea. I love that you're streaming straight from the lab, because a lot of patients have never been in an IVF lab, and it's a bit of a mystery, and that's where magic happens. But
well, welcome to everyone, and welcome to our my little kitchen here, where we cook up magic for you.
So I know that you've been dealing a lot with HFEA and all the regulations around starting treatment in the middle of a pandemic. And for our patients as well, a lot of them were feeling quite anxious, fearful, even frustrated when they had to have their treatment stopped or cancelled. But now that things are restarting, they're not really restarting normally. So there's a few adjustments that we need to make to keep things safe. And that's what I really wanted to know. What does it look like to have treatment in the middle of a pandemic? And maybe if we can start by areas, what it feels like to go through a consultation or to go through egg collection or then the embryo transfer. Tell us all about it.
Well, you know, your safety, a couple's safety, and individual safety is paramount. It's the most important feature when we are considering care at any point, if there's a pandemic or not. So, you know, as we're all aware, the government has put certain restrictions in the way that we are able to work and practice and travel. And exactly the same has been put in place in terms of an IVF clinic and IVF processes. So you'll notice a difference from the start, before you even get to the building, to have an initial consultation or a meeting with a nurse or to come for an actual procedure. In the first instance, you'll see that there are far more detailed communications by email. There's a suggestion that we will not see you face to face, but actually meet like this. A telecommunication may be the new normal. It may be a consultation via a video connection is the way that we are going forward. Plus, as I was saying, that our email communication may be different. We may be asking you to fill out consent forms, provide information, give us some details of whether we are or whether you have any symptoms of the disease, of the pandemic disease. So we'll be asking you a number of questions, providing a lot of information prior to a visit. If you do physically come into the clinic, we'll be asking you to have additional hand hygiene, using certain washes, hand washes, wearing masks. We may greet you in a very different way, interrogate you a little bit, asking you additional questions, taking your temperatures at reception. You'll notice the reception area will be looking very different. It will be far sparser. We'll have the chairs spread out, and you may be asked to wait in individual rooms and not go through the clinic as you would do in a normal situation as such. So the flow of people in the clinic has been reduced greatly. Then, if you are visiting the clinic, our communications and our interactions are kept down to the bare minimum. You'd be straight in for a scan, for example, or if you needed to speak to a doctor, it'd be a very short conversation, and then the rest would be taken up on the telephone or using telecommunication platforms to be able to provide information and care as we would like to. So although we're not able to spend as much time with you face to face in the traditional sense, we would like to spend time face to face like this or over the telephone, and to provide as much information as we can.
And so that's like general safety. And when it comes to the IVF lab, it's already one of the safest places in the world, where so many parameters are kept under strict conditions. Has anything changed, or was everything already prepared for a pandemic inside the lab?
Well, we have to have additional considerations. Our normal care and worry is about how we handle the people's gametes, their eggs, sperm, and embryos, and ensure that we have a very complete chain of moving items from one area to another when we're performing the processes to give the sperm a wash and brush up, for example, or before we mix the eggs and the sperm together. Now we've had the different considerations. I have to think as myself as a source of infection, and that's led us to additional hand washing with special reagents, increased wearing of gloves, using face visors and face masks when we engage with even basic things, when we are printing labels to place on culture dishes. We are very conscious of how we can introduce an infectious agent to surfaces, to each other member of staff in the laboratory, to affect liquid nitrogen, for example. So we have to make sure we try and keep that as clean and as clear as possible. So we are adopting far more stringent infection control elements and parts of our procedures. So our activities are changing quite a bit. But you don't have to worry about that. That's all behind the scenes in our kitchens.
Okay, and to think that so many patients weren't able to have their treatments, is there like a backlog of patients or a waiting list for patients to have treatment now?
Unfortunately, yes, that is the case. I mean, you know, we were forced by the government for the right reasons to stop IVF treatment, and now we are in the processes of prioritizing certain couples, unfortunately, or individuals to come through for treatment, and to see whether we can have a controlled flow of cases, not to be inundated. And we want to make sure that we've got sufficient time to give to you guys to be able to concentrate on your wants and needs and handle you and your material, your egg, sperm, and embryos as we would like. So yeah, unfortunately, you know, some couples will be experiencing delays, but we'll try and modify our processes as such to make sure that delay is as short as possible. I think that the biggest thing is that because we are having to change the way that we are communicating with you, is that you may have to wait longer for us to get back to you. The consultation process may be very different, and we are spending a long time on the telephone and telecommunication processes, that we are delaying that whole the whole system. One other problem is that we're having to limit the number of people in the building as such.
Okay.
So yeah, that is also a challenge. So unfortunately, longer delays or waits or shorter time with staff will be, the new normal, but we'll make sure that we modify our processes to make sure that we've got more access to you.
And when you're talking about prioritizing patients, does that mean that, for example, older couples who might be at risk of, every month matters more, are they taking priority, for example? Or is it healthy couples, or are you not doing patients who have, for example, diabetes or breathing problems, who are more at risk of contracting coronavirus? How are you managing that?
It's up to our clinical team to identify who are the key people to work with in the first instance. If there's one size doesn't fit all, and we've got to consider every situation by its merits and pluses and minuses. So we take that approach. It's everything we do at City Fertility. It revolves around individual care. So fortunate to have a very dedicated clinical team that will then assess each situation and see if we can fit certain, situations in sooner rather than later, depending on need.
And I think even though the UK was one of the countries that identified pregnant women as being at risk, but what we know so far from the European regulators and the American regulators is that there isn't anything in particular that makes pregnant women more at risk. So our patients don't need to be too concerned about getting pregnant during this time, isn't it?
Well, we've as a European company, our head offices are in the Czech Republic, in Prague. We keep our eyes on the European guidance and directions. Obviously, our British Fertility Society and ARCS and the HFVA, our rulers and governing body, do give us directions to enable us to act with the best practice. So we look at the Royal College of Obstetrics and Gynecology for direction, and in our engagement with NHS consultants that interact with us on a day-to-day basis to be able to get our awareness on how we should proceed in this situation. And we know, looking at the data, that there are risks and there's lots of unknowns, but fortunately pregnant women do not seem to have suffered as the fears were in the first instance. So we feel, and as directed by the government, that continuing fertility treatment and facilitating pregnancy is a relatively safe thing to do. I mean, we always make sure that we've got our eye on the latest publications and the guidance, and the rest on our NHS colleagues to ensure that there still is true. But we feel very confident to be able to offer you guys treatment and feel that the treatment options, if an infection were to unfortunately occur during pregnancy, are there to keep you as safe as possible. And we're buoyed by the evidence that it doesn't seem to be transmitted to children or cause issues during pregnancy.
Yes, that's great news. And I was thinking here, so we're doing all these checks when people start the process and every time they go to the clinic. So if someone starts ovarian stimulation and they do get coronavirus whilst they are stimulating their ovaries, what happens then? Does the process stop, or are they able to go ahead with egg collection?
I mean, again, we have to take a case-by-case assessment of the situation. So we rely on the clinical team to make evaluations and identify what is the best route to occur. So stopping treatment may need to be considered and has to happen, or we can generate generate embryos and freeze those if that is safe and suitable, or we can freeze eggs if that is a possibility also. So there are ways and means around this. Unfortunately, it may mean that we have to stop treatment, but we can continue and still, save the day with generating embryos and freezing those, or collecting oocytes and freezing those. But again, as I say, case by case situation, case by case evaluation.
And are you doing then COVID tests on everyone before they have interventions, or is it not? It's only if they have symptoms?
Well, as the government has dictated, that testing is a very important element to assessing the situation with the COVID pandemic, but it doesn't give us all of the answers. And sampling issues. There has been reports in the press and the literature about the reliability of testing. So we lean very, very heavily on our clinical team's ability to assess and triage. So take information from individuals and couples and identify if there are any key symptoms, and then that will help drive the way forward and maybe lead to testing. But we're not using testing as the be-all and end-all, just in case it doesn't give us all of the information.
I think that's a good point, because we know that there's a lot of people who do a test, a swab test, and it's negative, and it may be negative twice, and at the third time it will be positive. So it's not really that reliable. And then when it comes to the antibodies test, where they test the blood, it's also no useful, because it tells us if you've had the infection, but not if you have it right now. So you're right, testing is not everything, and it takes a while for you to get the results. So it might not be practical to do a test, and then in 2 days later you might have caught coronavirus straight after having the test done. So
absolutely, they are all of the issues. They are all this. I mean, there are a plethora of exceptionally intelligent people that are working on maximizing the quality of the test, maximizing the quality of the sampling techniques. And in time we're going to get there, and we're going to have exceptionally reliable tests, and we're going to have real-time testing that we can all be assured about. But at the moment we need to have we're in early days, and we need to rely on assessing symptoms, testing where appropriate and where necessary, and making sure that we keep an open mind, and just as you said, repeat tests if we have any concerns, but assess symptoms as well as we can.
Yeah, I think the biggest reassuring thing is that people can get pregnant, and they're not more exposed than other women who have gotten pregnant naturally. And there's a lot of women who have already delivered healthy babies during the coronavirus pandemic. So it seems to be safe to go ahead. And
we have to sorry.
No, yes, tell me.
We have to consider the obstetric data and information that we've got from China and from Italy, places that had very high levels of people that had contracted the disease, and they are a few steps ahead of us and more aware due to the time frame where the number of cases hit them at a high level. So looking at the data from those countries and looking at South Korea, for example, again, the evidence suggests that although there have been some negative outcomes, that the majority have seen a pregnancy and a live birth event occur in a with some complications, with additional monitoring and care, but have had some safe outcomes at the end.
And there's a question from a patient here. The patient is asking if these new regulations are likely to last a few months or a bit longer. And I guess we don't know, but I think it's an important question, because if someone is in their early 30s, they might be able to wait. but if someone is 38, maybe it's a bit trickier to wait a few months.
Well, you know, we've been given direction from our learned governing body. They are leaning on the Department of Health and Social Care, who are leaning on clinical and scientific experts that are saying to us that we are able to continue as, you know, with precautions, but continue with care for patients who wish to, and individuals who wish to attempt to have their pregnancy. So the indications so far suggest that we are able to go ahead and try and achieve a pregnancy. So, you know, there doesn't seem to be an indicator to say that you need to wait. Basically, if you can go ahead and you feel it's acceptable, then yeah, come and see us, and we can try and fit you in to get your treatment planned as soon as possible. And you're right, you know, if you're younger, in your 20s or early 30s, and you feel that the risk or the worries and concerns and the stresses surrounding the pandemic a little too much for you, then by all means, you know, if you have a consultation with one of the doctors or your doctor, and they feel that it's an acceptable thing to do, then yeah, wait by all means. But yeah, you're correct. Ladies who are a little further on in their reproductive journeys may need to be acting right now.
And are the consultations that from the counselors and the support, emotional support consultations, are they still happening at the clinic, or are these remote until further notice?
We've always offered a patient choice approach to offering counselling support and giving information counselling. So we've had the opportunity to be in the clinic, to use telephone or use teleconferencing platforms to perform counselling sessions. So we'll continue in the same way, reducing the opportunities for in-house, in-clinic consultations and support sessions, but using the teleconferencing and telephones more. But the access to our counselling team, either clinical, nursing, scientific, or genetic if necessary, as well as the supportive counselling, can occur as at a couple's needs and wants, or an individual.
I think before the pandemic, a lot of people were reluctant in having remote consultations on Skype or Zoom, but the coronavirus has forced the whole world to adapt rather quickly to technology. And all of these Zoom meetings and Skype meetings have suddenly become the new normal. So I think more and more people are considering these remote consultations, and they're thinking it's actually quite comfortable from the comfort of my own home to be able to talk to my doctor, to my nurse, or to the counselor. And if there's like one advice that you would give to the patients who are listening and are feeling maybe a bit anxious or a bit uncertain, what advice would you give them if they are thinking that maybe they should start treatment now?
Feel reassured that we have spent a vast amount of time considering and assessing the way that we work, and we are focused on offering you exactly the same quality of care that we did in the old days, pre-pandemic, to now. And really, I feel, having spent a number of hours on the telephone myself and a couple of Zoom meetings, that, although there are other telecommunication platforms out there,
Yes.
that we are engaging more with couples and individuals. We are engaging more with people who want to have treatment. So although we're not being able to see people physically face to face in a short distance, we are engaging with people far more like this. And you have the opportunity to get in contact with us, and we'll get back to you. And we're on the phone constantly. I've spent more time on the telephone and doing this than I do normally, and I've really enjoyed it. And I hope that the people that I've engaged with are enjoying it as well. And I feel it is quite positive, and I've got very good positive feedback from them. So I would say you don't need to come and see us, because we can come and see you. And just as you said, Andrea, we can come and see you in your living room or in a conference room at work. So many people have had issues of getting out of work. We've managed to use remote platforms for consenting, remote platforms to be able to talk to people. So we are able to work around you a little bit more, and we want to do that even more.
We have here a patient who has written a comment. They are having treatments at Gannett City Fertility, and their experience has been great so far. And I know they've been very excited to see your kitchen. Your kitchen. I think it's to give an insight into what happens behind the scenes.
I'm sorry that I can't show you around, because we have people's names on incubator doors and the like, but I'm happy to let you see where it all happens.
Shaun, thank you so much for joining us today. It was lovely to have you here. Thank you so much for reassuring our patients, our listeners, about the safety of having treatment during this time that can be so anxious for so many patients. But it's good that it's going ahead, and it's good that we're helping patients grow their families. And if anyone who's listening doesn't know about Gannett City Fertility, they are based in central London near St. Paul's. You can follow them on Instagram, go to their website, ask us any questions you have via direct message. And that's it, really. Shaun, thank you so much.
Thank you for having me in your living rooms, and thank you for listening in.
Bye, Shaun.